What physical impacts does smoking have? And how smoking affects the body, or the top horrific effects of smoking on your body. Welcome to Smart DX Media, where public health, education, information, and our general well-being are extensively considered very important. Kindly watch, subscribes, share, and hit the notification bell icon so that, each time we release new health tips or videos, you should be notified as well. It's not very healthy, to say the least. Welcome to Smarts Media. Today we're counting down our picks for the top terrible things smoking does to your body. Before we begin, we publish new content every day, so be sure to subscribe to our channel and ring the bell to get notified about our latest videos. For this list, we're looking at the most harmful and dangerous effects that smoking has on the human body. Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as their ingredients make their way through our bodies, and how we benefit physically when we finally give up smoking. Smoking affects the body in many different ways. When an individual smokes, the nicotine travels to the brain and causes the brain to release dopamine and other neurotransmitters, which results in a pleasurable sensation. With each inhalation, smoke brings more than 5,000 chemical substances into contact with the body's tissues. 1. It causes cataracts. 2. Smoking damages many areas of the body, including, perhaps surprisingly, the eyes. Research has shown that smokers have double the risk of developing cataracts. The clouding of the eye's lens that results in significantly reduced vision, a sensitivity to light and muted colors. Doctors explain that smoking alters the cells of the lens and causes a significant buildup of cadmium, both of which may result in cataracts. While it's estimated that half of all Americans may develop cataracts by the time they reach 80. Since smoking significantly raises the chances. 3. The chemicals in smoke also causes the constriction of blood vessels. This forces blood to move through a smaller space. This can damage the walls of the blood vessels. Over time, the blood vessel walls become thick and hardened. There is an increased risk of blood clots forming too, which can cause a stroke or even a heart attack. From the start, tar, a black, resinous material, begins to coat the teeth and gums, damaging tooth enamel, and eventually causing decay. It causes gum disease, bad breath, and tooth loss. Seeing as how you smoke through your mouth, it's only natural that it causes significant damage to that area. Aside from the aforementioned smoker's pucker, smoking also makes it harder for your body to fight off gum infections like gingivitis due to the body's weakened immune system. It also makes treatment of said diseases more difficult and puts you at twice the risk of developing some form of gum disease. The diseases could also lead to teeth loss, as the bone and tissue that hold your teeth in place become damaged and weakened. There's just no winning when it comes to your mouth and smoking. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airways and lungs, smoke increases the likelihood of infections, as well as chronic diseases like bronchitis and emphysema. Smoking weakens bones, can cause eye diseases and problems with the immune system. It weakens your bones. Smoking literally affects your right down to your bones. It's been known for decades that smoking breaks down the integrity of the bone and results in an increased risk of osteoporosis, a bone disease that typically affects the elderly. The bones become so weak and brittle. With the disease that bones breaks are common even with minor stress on the bone. A study by the American Chemical Society showed that smoking produces excessive amounts of two specific proteins that the body uses to break down bone density. The result is significantly weaker bones and an increased risk of damage and injury, including fractures and breaks. It does this by damaging the cilia, tiny hair-like structures whose job it is to keep the airways clean. It then fills the alveoli, tiny air sacs that enable the exchange of oxygen and carbon dioxide between the lungs and blood. A toxic gas called carbon monoxide crosses that membrane into the blood, binding to hemoglobin and displacing the oxygen it would usually have transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensations which make smoking highly addictive. nicotine and other chemicals from the cigarette simultaneously cause constriction of blood vessels and damage their delicate endothelial lining, restricting blood flow. These vascular effects lead to thickening of blood vessel walls and enhance blood platelet stickiness, increasing the likelihood that clots will form and trigger heart attacks and strokes. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. In fact, about 1 of every 3 cancer deaths in the United States is caused by smoking. And it's not just lung cancer. Smoking can cause cancer in multiple tissues and organs, as well as damaged eyesight and weakened bones. It weakens the immune system. Though smoking often affects specific organs, it can also cause more general widespread harm as it does with the immune system. Smoking damages and reduces antibodies in immune cells, resulting in a much weaker immune system, which could lead to easily caught and longer-lasting sickness, severe illnesses and infections, or even death. It also lowers the levels of antioxidants like vitamin C and weakens cancer-fighting cells, which is why smoking is so often correlated with cancer. However, there is hope, as studies have shown that a weakened immune system can grow stronger when a smoker gives up cigarettes. The damage is not irreversible. It increases the visible signs of aging. Smoking doesn't just affect your organs and immune system, it alters your physical appearance as well. Smoking restricts blood flow to the skin and damages the skin's elasticity, resulting in premature wrinkling. Aside from premature wrinkles, smoking also causes sagging under your eyes, a poor skin tone including off-colored skin, a smoker's pucker, age spots, hair loss and crow's feet, all of which contribute to a significantly aged appearance. While these effects are not reversible, it is possible to limit their severity by quitting smoking. It causes infertility. Smoking is definitely one of the worst things you can do to your reproductive system. Smoking can result in numerous problems, infertility including issues with ovulation, damage to the eggs and damage to the reproductive organs themselves. However, it's not just females who are affected. Male smokers also faced serious fertility problems, including a dramatically lowered sperm count and erectile dysfunction. Even if smokers manage to get pregnant, smoking considerably raises the chances of a miscarriage or a baby born with notable and numerous health issues. In short, smokers, both male and female alike, may face significant problems when trying to conceive. It makes it harder for women to get pregnant. And in men, it can cause erectile dysfunction. But for those who quit smoking, there's a huge positive upside with almost immediate and long-lasting physical benefits. Just 20 minutes after a smoker's final cigarette, their heart rate and blood pressure begin to return to normal. After 12 hours, carbon monoxide levels stabilize, increasing the blood's oxygen carrying capacity. A day after ceasing, heart attack risk begins to decrease as blood pressure and heart rates normalize. After 2 days, the nerve endings responsible for smell and taste start to recover. Lungs become healthier after about 1 month, with less coughing and shortness of breath. The delicate hair-like cilia in the airways and lungs start recovering within weeks, and are restored after 9 months, improving resistance to infection. By the 1-year anniversary of quitting, heart disease risk plummets to half as blood vessel function improves. 5 years in, the chance of a clot forming dramatically declines, and the risk of stroke continues to reduce. After 10 years, the chances of developing fatal lung cancer go down by 50%. Probably because the body's ability to repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as that of a non-smoker. There's no point pretending this is all easy to achieve. Quitting can lead to anxiety and depression, resulting from nicotine withdrawal, but fortunately, such effects are usually temporary. And quitting is getting easier, thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges, and sprays may help wean smokers off cigarettes. It makes your blood thicker. It may sound disgusting, but smoking does indeed thicken the blood. Smoking basically turns your blood into sludge, turning the essential substance into a much thicker and stickier fluid. By extension, this forces the heart to work harder to distribute it around the body. Smoking also pumps cholesterol and fat into your blood, which increases the chance of developing a blood clot and by extension a heart attack or stroke. Finally, sticky blood can cause significant damage to the lining of your blood vessels. Smoke can damage nerve endings in the nose and over time can cause a loss of smell. A loss of taste can also occur, and other problems include anxiety, irritability, yellow fingers and wrinkly skin. The harmful effects of smoking on the lungs increases the risk of infections and diseases such as COPD. Smoking harms the ciliary hair, which keep the airways clean, the alveoli in the lungs. Fill with smoke. Remember, the alveoli is where the exchange of oxygen and carbon dioxide takes place. Therefore, if the alveoli fill with smoke, then the toxic gas carbon monoxide passes through into the capillaries and is passed around the body instead of the oxygen. This causes an individual to feel shortness of breath, and due to oxygen deprivation, a persistent cough is also very common in smokers. A huge risk of smoking is the risk of developing cancer in many different parts of the body. Smoking can also affect fertility in both males and females. However, when an individual decides to quit smoking, these risks reduces. There are many people that can help and many resources available if you would like support with quitting smoking, and quitting is getting easier, thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges, and sprays may help wean smokers off cigarettes. It makes your blood thicker. It may sound disgusting, but smoking does indeed thicken the blood. Smoking basically turns your blood into sludge, turning the essential substance into a much thicker and stickier fluid. By extension, this forces the heart to work harder to distribute it around the body. Smoking also pumps cholesterol and fat into your blood, which increases the chance of developing a blood clot and by extension a heart attack or stroke. Finally, sticky blood can cause significant damage to the lining of your blood vessels. Smoke can damage nerve endings in the nose and over time can cause a loss of smell. A loss of taste can also occur, and other problems include anxiety, irritability, yellow fingers and wrinkly skin. The harmful effects of smoking on the lungs increases the risk of infections and diseases such as COPD. Smoking harms the ciliary hair, which keep the airways clean. The alveoli in the lungs fill with smoke. Remember, the alveoli is where the exchange of oxygen and carbon dioxide takes place. Therefore, if the alveoli fill with smoke, then the toxic gas carbon monoxide passes through into the capillaries and is passed around the body instead of the oxygen. This causes an individual to feel shortness of breath due to oxygen deprivation. A persistent cough is also very common in smokers. A huge risk of smoking is the risk of developing cancer in many different parts of the body. Smoking can also affect fertility in both males and females. However, when an individual decides to quit smoking, these risks reduce. There are many people that can help and many resources available. If you would like support with quitting smoking, they work by stimulating nicotine receptors in the brain and thus preventing withdrawal symptoms, without the addition of other harmful chemicals. Counseling and support groups, cognitive behavioral therapy, and moderate intensity exercise also help smokers stay cigarette-free. That's good news, since quitting puts you and your body on the path back to health. Disclaimer: the information in this article or video cannot and should not replace a medical consultation and must not be used for self-diagnosis or treatment, but rather clinical awareness or public health.